Now we'll focus on the upper respiratory tract infections of the respiratory system. Starting first with the common cold, one that we are unfortunately all very familiar with. This is often called rhinitis, which includes nose and inflammation leads to this term rhinitis. Multiple people with colds, actually $1 billion in healthcare related to having a cold and missing work. Some of the signs and symptoms, of course, sneezing, scratchy throat, runny eyes, typically not accompanied with a fever, though children can experience it more often. Infection actually predisposes, though, to secondary infections. So again, once somebody has a cold, it just weakens the immune system, allows other opportunistic infections or secondary infections to occur. And the symptoms that we experience from this are typically from the immune response to the virus, more so than anything specific about the virus that it is causing. It's more the immune response that causes the issues. So the causative agents, over 200 different kinds of viruses actually can cause the common cold. 99 of them are rhinoviruses, coronavirus, adenovirus. We'll talk more about RSV later, the respiratory syncytial virus. And this is caused or transmitted by droplets or indirect transmission, so picking it up from a doorknob or something where those droplets have been passed on. There are no vaccines to it, mainly because there are so many viruses that cause it, and no specific target or drug that can be used to treat it. Our summary table, again, over 200 viruses in different families. That indirect contact or droplets are how it's transmitted. Virulence factors that are in common with these viruses, of course, they need to be able to attach to those capsid proteins. But again, most of those responses are most of our symptoms are actually due to the immune response. So good hygiene practices, just preventing transmission, and treatment is only for the symptoms. So again, decreasing, like an anti-congestion, something like Sudafed or ibuprofen, just to help with sore throats, that type of thing. All right, then an infection of the sinuses or sinusitis, again, inflammatory condition. Of any of the 4 pairs of sinuses in the skull. This can be caused either from allergies or an infection. So determining the treatment, it's helpful to understand which one is actually causing it. Again, this is a common one that is a secondary infection to the cold. So often whenever individuals get a cold, they often will get sinusitis as well, that inflammation of the sinuses in response to the virus causing the cold. Signs and symptoms, sinus pain, congestion, a lot of pressure and headache, even down into the mouth, or toothaches that can occur. Discharge is typically opaque, kind of see-through, but can be kind of a yellow-green color. And again, that increases as your immune system's way of trying to get rid of that virus, increasing mucus to expel that antigen. So a few causative agents. Again, this can be caused by viruses, which are the most common of them. Again, it's typically the same ones that cause the common cold, also can lead to sinusitis. But there can be bacterial and fungal infections that lead to sinusitis. For the bacteria, most of them come from the normal biota that occur. And again, while it can happen with fungi, it is very rare, but recognized whenever the antibacterials don't work on the symptoms. So looking here at our table, so again, depending on the cause, the majority are caused by viruses. So again, same with the common cold, so direct contact or indirect, proper hygiene to prevent it. no real treatment, again, just treating the symptoms of that. Some of the distinctive features here, so viral and bacterial are much more common than the fungal. And then here again with the bacteria, multiple different bacteria, but the majority of them are endogenous, so they're opportunistic. So again, the immune system gets weakened and it allows those bacteria to go unchecked. Again, really no prevention for it. Treatment here, recommendation is actually not to use an antibiotic, just helping to decrease that antibiotic resistance. However, if it doesn't get resolved in a few weeks, then antibiotics can be prescribed. And then again, same with the viral and bacterial, much more common. But there are some fungi that can cause it, and this is typically introduced by trauma. So again, somebody who gets hit in the face, maybe like with a baseball or something like that, in a fight, that can introduce fungi into the sinuses. Or again, as a secondary infection, those opportunistic fungi can kind of overtake the immune system to lead to that sinus infection. So treatment is actually physically removing the fungi in severe cases or just using antifungals. Again, typically this is going to occur in those immunocompromised. All right, now looking at the ear infections or acute odious media. This is common sequela of the common cold. Again, common cold leads to multiple other infections like sinusitis or an ear infection, typically due to inflammation of the eustachian tubes that build up fluid in the middle ear, causing that pain and pressure. The bacteria can migrate along those tubes, increasing the inflammatory response, and then secreted fluid causes, or that secreted fluid is referred to as effusion, which we'll see in the next slide. Now there can be chronic odious media, especially in children, where they constantly, it seems like one ear infection gets cleared up and then they just get another one. So these chronic kind of long-term ear infections, this is due to that fluid buildup in the eustachian tubes and typically caused by kind of a mixed biofilm. Again, those antibiotics just can't quite clear all of them up. So after they go off the antibiotic, within a week, those bacteria left in the biofilm are right back at it, causing another ear infection. So signs and symptoms here, so essentially a fullness or pain in the ear, even some loss of hearing. It just kind of seems garbled. In kids, they can be, irritable. They have a hard time sleeping, eating, or hearing. But also, it can cause the eardrum to burst and kind of severe ear infections or even more serious infections can result. So typically kind of a watchful waiting for a couple days to see if the immune system is able to clear it up. However, antibiotics can be used or tubes can even be placed in for those with chronic, especially again in children. If they have chronic ear infections, tubes can help alleviate those symptoms. And again, this was the figure I was referring to earlier. So this effusion that causes inflammatory exudate here in the middle ear, so it causes the eardrum to kind of bulge or get bigger. Again, it can rupture in severe circumstances. Those eustachian tubes become inflamed and enlarged. Again, it causes pressure, changes the flow or the flow of those hair cells that alter the hearing. Again, pain, pressure. And typically these are going to be caused by a bacteria called Streptococcus pneumoniae, as the name implies. This one's also going to be seen in pneumonia. It's a gram-positive diplococci, so two of them that are joined together. However, there is kind of an emerging and worrying cause of ear infections that's caused by a fungus called Candida aureus. So aureus for the ear, Candida for the fungal infection. But a lot of different bacteria and viruses definitely can cause them. but it is not communicable. So if somebody has an ear infection, they can't pass that on to another individual. All right, so just looking here at our disease table, again, the majority are caused by Streptococcus pneumonia, but a few, again, by that fungi Candida aureus. So with our bacterial cause, this is endogenous, and again, can typically follow a cold or other upper respiratory tract infection that weakens the immune system and allows this opportunistic bacteria to kind of go out of whack. It does have a capsule, so it makes it hard for phagocytes to recognize it and capture it, and it produces hemolysin to break down those red blood cells. There is actually a vaccine that's available against this type. And then treatment, though, is typically waiting for resolution, but then antibiotics if needed. And then again, for those that are less than 6 months, some different antibiotics are important for those. Now in the fungal, again, this is that biofilm formation of this fungal infection, and it can actually is recommended to consult the CDC. It is one that is being watched due to that antibiotic resistance, so urgent category CDC report is required for that. Okay, now looking at our throat, so pharyngitis, so inflammation of the throat causing pain and swelling. Again, a lot of the same viruses that cause the common cold. The most serious, though, or strep throat is referred to or caused by Streptococcus pyogenes and another bacteria called Fusobacterium necrophorium. Some of the signs and symptoms, especially with strep throat, are the white pockets that are visible on the walls of the throat, difficulty swallowing, also bad breath. With the viruses, so viral sore throat is typically much more mild, can cause kind of some hoarseness that isn't actually seen with strep throat. With bacterial, though, it's more painful, often fever results, headache, and nausea are also common with a bacterial cause. Again, just kind of looking, this would be more with the strep throat. So the tonsils here, so you can see they're very inflamed. You can also see all the little white patches on them. That's indicative of strep throat. Those typically aren't seen with a viral infection, so with a cold, those are less likely to be seen. All right, so looking a little bit here at the Streptococcus pyogenes, so it is a gram-positive coccus, as the name implies. It does grow and change. The strepti part kind of gives that one away. Facultative anaerobe, so it can go through aerobic or anaerobic respiration. It has capsules and a slime layer to help it attach, but also that prevents our immune system from being able to easily recognize it. Untreated infections can actually cause some very serious complications, including scarlet fever, rheumatic fever, and glomerulonephritis in the kidneys. So some of the virulence factors that we see, it does produce a surface antigen that looks like the host protein. So again, makes it hard for the immune system to recognize it because it looks like it's supposed to be there. There's an M protein that aids, helps it resist phagocytosis, also is used for adhesion. Those surface antigens protect it from being affected by lysozyme, because again, it's gram-positive, so that should help. But those antigens, again, kind of act like a layer to protect them. It does produce streptolysin O and S that can injure cells and tissues. Produces a toxin called erythrogenic toxin. So this is produced by some of the lysogenic strains that actually kill the cells to get out of them. And this is one of the key factors for scarlet fever. And then some of those toxins can act as superantigens that kind of overactivate the immune system, so we get an enhanced immune response. But again, the negative effects negative effects of the immune system can become an issue. And this is just kind of looking here with the Streptococcus. So a lot of flushing typically is seen due to some of those toxins that are being released. Again, rapid strep tests can be used to diagnose these infections as well. So then our other one, the Fusobacterium necrophorum. So only in recent years has this actually been recognized as a potentially dangerous bacteria. About 15% of acute pharyngitis cases. It is gram-negative, but it causes these peritonsillar abscesses that are called Lemierre's syndrome, which can be life-threatening. So looking here at our summary table, again, strep pyogenes leading to strep throat. So it is transmitted by droplets or direct contact. Quite a few virulence factors here, including those different antigens. M protein creates a capsule that has hyaluronic acid on it. Again, these super antigens become an effect. It can even induce autoimmunity. So again, quite a few virulence factors produced by the Streptococcus pyogenes. Hygiene practices can help in preventing them because it's transmitted by droplets and direct contact. Can be treated with penicillin because, again, it is gram-positive, so that allows penicillin to be effective, or cefalexin if penicillin allergies are present. Some of these distinct features is that it is typically more severe than the viral. So again, the bacterial can cause that fever, much more painful, much more severe than a viral infection. Then the Fusobacterium, this is actually typically endogenous, so it's part of bacteria that is commonly found in our normal flora, but again is able to grow out of control. It is very invasive, but produces an endotoxin. Treatment can be used with, or can be effective with penicillin, but again, it can be life-threatening, leading to that Lemierre's syndrome. And then the viruses, all forms of contact here that can cause it. Again, good hygiene to prevent it. Same with the common cold and the ear infections, just mainly treating the symptoms. The hoarseness, though, is more frequent with the viral infections than it is with the bacterial, and typically less severe than the bacterial.